AD109 is a combination drug of atomoxetine and R-oxybutynin, which is unique in respect from the standpoint that it targets the neuromuscular activation, which, as I mentioned, is one of the endotypes that is responsible for sleep apnea. So we know that, most patients with sleep apnea have narrow airways, but there are a variety of endotypes that my colleagues at Harvard have really worked on in the Wellman lab at the Brigham, trying to identify how people may respond to one treatment versus another, really moving toward personalized medicine. So the endotypes that we look at are inadequate neuromuscular activation, which AD109 targets, and high loop gain, which is an element of ventilatory instability that can perpetuate sleep disordered breathing events. And then the third endotype is a low arousal threshold. So if someone is easily awakened, frequently that gets in the way of adequate treatment of obstructive sleep apnea. And other work that ourselves and other people have done in the area of what we call COMISA, or comorbid insomnia, frequently gets in the way of having a satisfactory treatment response. With and really, as you know, I mean, we have, the standard of treatment for sleep apnea, obstructive sleep apnea in the community is CPAP. And unfortunately, there are patients who can struggle with this therapy, being able to either accept it or to adhere to treatment. And that's why, having additional tools in the tool belt are very important to be able to personalize care for a given patient. That's number one. And number two is that, taking care of obstructive sleep apnea, it's a chronic problem. And the journey that the patient goes on is really, may change over time, right? So one treatment that is sufficient with a young adult may not be the same treatment that is the right fit for an older adult, or as comorbidities, tend to accumulate, unfortunately, as people get older. So that's why having additional treatment options is so important. And AD109 is something that we think will be, quite helpful in our OSA population, because we know, OSA in the United States, there's probably, it's projected that there are approximately 80 million people that are affected by obstructive sleep apnea from one degree to another. However, only about 16 million individuals have been offered CPAP as a treatment option. Some of those people do exceedingly well in our clinic. Some of them really struggle with that therapy. And as you also know, is many people have not really even gone through diagnostic testing because they may be fearful of the possibility of having to use mask-based therapy, which sometimes that's related to just poor understanding of the treatment, but there are people that we have to move on for other treatment options. So that's one of the reasons why I feel that having additional approaches, oral appliances, upper airway stimulation, and some of the newer drugs that we have. And as you know, there are two different drugs now. One that's FDA approved, tirzepatide by Lilly, that now has been approved for treatment of obstructive sleep apnea. Unfortunately, not everyone, or fortunately, depending on how you look at it, not everyone with obstructive sleep apnea is overweight and obese. And in fact, in SynAIRgy, one of the nice things that we were able to do in this particular trial was try to really recruit individuals with a broad spectrum of weight. So about a third of the patients in the SynAIRgy trial were either normal weight or overweight but not obese. So those patients would not be suitable for a treatment with tirzepatide because the mechanism of action for tirzepatide is to decrease overall body weight and probably fat in critical real estate in the upper airway, right? So the nice thing about AD109 is it's a really completely different mechanism of action. It targets neuromodulation of upper airway muscles, and the treatment effect is immediate. So as opposed to tirzepatide, which takes time for individuals to lose weight and see the benefit of probably affecting the narrowing of the airway. So that is the exciting thing about this. And again, being a phase 3 trial, this was really informed by the phase 1 and the phase 2 data. So the phase 1 data, which the Wellman Lab published in Science a number of years ago, using atomoxetine and oxybutynin, what they found was there was a significant reduction in the apnea-hypopnea index in one night. And then the Mariposa trial, which was the phase 2 study, really kind of informing the phase 3 study, which is more of a definitive trial for FDA, really examined individuals, a smaller N, and of individuals who have obstructive sleep apnea over 1 month. So SynAIRgy is really looking at a much larger N that is ethnically and sex diverse, which is different than many of our trials in obstructive sleep apnea, which tend to focus on middle-aged, usually Caucasian men, right? So in this particular trial, there was an equal distribution of men and women, and also an ethnically diverse population. So that helps us understand, how generalizable, the treatment would be. So that was the strength of the study, over 600 participants, and much more diverse than some of the other trials.